I think another benefit of ultrasound, and another area where it's used very commonly, is for procedures. Like I talked about, it is a more real-time imaging modality than CAT scan or MRI and that sort of thing. And so ultrasound is used every day in multiple spots in the hospital to actually intervene and to do something in the patient. And I think that that's just a novel part of ultrasound, and something that makes it fun for us, because if somebody needs a kidney biopsy, or if they have a tumor in their liver, or if they are really sick and they need a large IV placed in their neck, we can use ultrasound to actually see that structure and to watch ourselves put a needle directly into it. And I think that not only is kind of fun and satisfying for us, but it really improves patient safety. Instead of kind of blindly guessing or exposing them to ionizing radiation like during a CAT scan, we can use ultrasound, which is inexpensive, has no ionizing radiation, and we can literally watch what we're doing while we take a sample of that, or while we put a tube where it needs to be. And so I think that's a big benefit of ultrasound, and something that we really commonly use it for and enjoy its use for. I think additionally, ultrasound is something that is kind of rapidly expanding in I don't know if third world countries is the right term, but in developing countries, as well as in disaster situations, it's a heck of a lot easier to take a portable ultrasound machine than it is to try to set up a CT scanner. And so I think that the portability, the lack of ionizing radiation, and the real-time aspect of it make it a really valuable part of our arsenal. Even though it often has lower image quality, it has some very valuable characteristics that I think make it a really important tool that we can utilize. I think that ultrasound has a continued future in radiology. I think MRI is probably the current area where people are focusing a lot more of their time and research efforts. But I think that there's ongoing improvement within the field of ultrasound. I know specifically that we've kind of watched the trend even in the last decade or so of improvements in the monitors, improvements in the ability of the computers to process the information quickly, improvements in the transducers, sometimes just little things like the size of the transducer. One of the more recent developments that has been beneficial for us is transducers that are able to change the frequencies that they scan at. So instead of having to change from one transducer to another, one transducer may be able to scan over a range of frequencies, so that it might give you more information on superficial and deep structures without fully sacrificing that increased resolution. So I think there will be continued improvements within ultrasound of just bettering our resolution and bettering the speed with which we can obtain it, and hopefully just making it more portable and more accessible